Hey guys, so it's Dr. Ryan, and today we're going to talk a little bit about my approach to hair loss on TRT. And I fully recognize that this is kind of a strange topic coming from a physician who chooses to shave his head, and that's true. I do shave my head. But I have a large proportion of patients who want to maintain hair and a lot of success with them maintaining a nice hairline when they start testosterone replacement therapy. And it's very possible to do so with the medical therapies that we have available. Okay, so let's just go ahead and talk a little bit about some of the interventions we can utilize for hair loss when you get on testosterone replacement therapy. So just a little background as to why we get it. So testosterone converts to 5-alpha, converts to dihydrotestosterone via 5-alpha reductase enzymes, and there's the main theory as to why we think we get hair loss with testosterone is that certain individuals have higher androgen receptor density or sensitivity on their hair follicles to DHT, which predisposes them to hair loss, right? And there's a great article here in Androgenic Alopecia, right here, which kind of also, in addition to the fact that it's the sensitivity and the density of the receptors, there is a genetic basis as well. There have been numerous studies that have noted several different single nucleotide polymorphisms at different genomic loci. However, there have been many studies that have unequivocally identified two major genetic risk loci for androgenic alopecia on the X chromosome AREDA2R locus and the chromosome 20p11 locus. So there may be some sort of validity to the thought that if the men on your mother's side are balding, well, you might be predisposed to it because this large genetic risk loci is found in several studies on the X chromosome. Right now, again, there are many other genes and many other signal nucleotide polymorphisms, so there's always exceptions, but there is some truth to that. The other thing that's kind of interesting is that with testosterone, we like to think, oh man, excessive levels of testosterone makes everyone bald. But that doesn't seem to be the case with women, appropriate levels of testosterone at least, because this article actually here looked at an improvement in scalp hair growth in androgen deficient women. So it's not just men that can have issues with hormone poor testosterone optimization. Women do too, and I have several females in the clinic as well. And my experience with them, provided of course the therapy is appropriate and levels stay within range, in the high normal range, is that their hair loss is not affected very much at all and sometimes improved. And in this particular article, they looked at 285 women that were treated for a minimum of a year with subcutaneous testosterone implants, and a significant proportion, about a little more than 20%, or just under 20% of them, reported hair regrowth on testosterone therapy, scalp hair regrowth, which is pretty cool. So it appears that for women, it may not be nearly as much as an issue for guys. Now, there is, of course, some controversy as a true cause of androgenic alopecia, and I've included all these articles in the bottom of the YouTube video. This particular individual, Dr. Eastener, has this great article on titled "Cause of Androgenic Alopecia: Crux of the Matter," and his thought is that it may not necessarily be due to androgen receptor sensitivity or density, but more so due to scalp pressure. And it's kind of interesting. I would urge you guys to take a look at the article. But the premise of what he says is the reason for balding is that there's increased pressure on the scalp as we age, which causes increased downward pressure on the hair follicles, which make it harder for them to grow hair through the dermal papillae. And why does this occur? Well, the subcutaneous fat tissue is higher in children and in individuals with lower testosterone levels. As your testosterone levels rise, that's one thing that we notice that can decrease subcutaneous fat tissue, particularly in the scalp, and that can decrease the volume of the dermis and somewhat exert pressure on the scalp. And another thing that we also notice is as we age, typically the subcutaneous fat in the scalp also decreases, right? So both testosterone administration and age can lead to this. Now, you might ask, well, why doesn't this occur all around the scalp? Well, his thought is that there's an increased force of downward force on the top of the scalp versus on the sides, and that is what he uses to explain why balding seems to occur primarily in the vertex and the frontal portion, and then along the top versus on the sides and the back, which kind of makes sense. And that's kind of interesting, because the reality is, as you start TRT, your metabolism does increase, and many individuals will get leaner. So, and it occurs everywhere, not just on your abdomen or lower back, but also in your face and probably on the subcutaneous fat in your scalp. And so, what he feels is that increased pressure due to the decrease in the sub-Q space may be linked to that. So just an alternative thought as to what might be causing it. Okay, so the three main types of therapy for androgenic alopecia are the following: Minoxidil, Ketoconazole shampoo, and Finasteride and dutasteride. Now, I want to make sure before we get into these therapies, not the vast majority of my patients don't have any issue with testosterone and hair loss. I think it's really because with appropriate TRT, you're only trying to get your test levels up to high normal, the levels that you would likely be when as a appropriately functioning 20 or 30-year-old. It's really, I start to see issues with individuals who use super physiologic doses of testosterone. So a typical individual in my clinic might be using somewhere between 100 to 150 milligrams of testosterone a week, depending on where their levels are. And you typically do it in smaller daily dosing, so the level's a lot more stable. However, a typical bodybuilder might use something like 500 to 1,000 milligrams of testosterone. And as you can guess, there's a lot more conversion of testosterone to DHT when you use much higher doses. Hence, probably why you see a lot of those pro guys get, unfortunately have to shave their head, right? Again, I don't know if I've seen a tremendous amount of individuals with significant hair loss. There are a few that do, and we can adjust their testosterone dosage down, but usually it's at a much slower rate, or is almost minimal. Regardless of that, if your goal is to maximally retain your hair follicles, it probably is prudent to start these therapies when you get on TRT. So the first therapy is Minoxidil, and everybody knows about this. This is an ATP potassium channel opener, which was primarily used for blood pressure. It's a vasodilator, but the pharmacist involved with it noticed it had an interesting side effect in that it increases hair growth. We're not entirely sure why it does so. It may be secondary to the fact that it causes vasodilation in the blood vessels that are giving more blood nutrients to the hair follicle. But there's probably other reasons for this as well. But we know it works, and it works well. And so this is something that has been studied again and again, and has been noted in many different articles. Here's one from 2015. And let's see here. This particular group, this is a review of most of the articles in which patients were exposed to Minoxidil, and they mentioned a significant higher portion of participants in the Minoxidil group had greater hair growth than participants in the placebo group, as judged by both investigators and self-reports. So definitely works, and definitely something to consider. One thing that is starting to become a lot more interesting is oral Minoxidil. So, there are some people that can't really tolerate the topical hair solutions because, the liquid stuff can kind of flake, and it can leave this like dandruffy sort of residue, which then nobody likes that. And then the cream is kind of messy, and you have to apply it twice a day, which is a little inconvenient. So there have been some forward-thinking dermatologists and hair transplant surgeons and people involved in hair restoration surgery, or just hair restoration period, that have been experimenting with oral minoxidil, and they've been experimenting with good results. And here's a great review article of oral minoxidil and the treatment of hair disorders. And so these authors, they have noted that there have been some success. Oral minoxidil has been proven to be successful and well-tolerated alternative for patients with hair loss, including those with poor adherence to other therapies. Okay, there hasn't been a dose that's discussed as a adequate dose for most patients. However, the dosing regimens that have worked have been anywhere from 0.25 to 5 milligrams daily, and typically most of these studies have not gone much higher. If you are using it and you're female, they suggest going to 0.25 to 2.5 milligrams daily, whereas men probably require something between 1.25 to 5 milligrams daily. As there isn't really a standardized dose if you do want to try this sort of therapy, and I have been utilizing it with a few patients, 2.5 milligrams seems to work pretty well daily. Okay, well, that's minoxidil. What about ketoconazole? Well, ketoconazole shampoo, it's also known as Nizoral. Well, Nizoral, if you get that over the counter, is 1%. The prescription is 2%, which is what I would recommend if you want the best for hair loss. So, ketoconazole is associated with hair growth, and here's an animal study in 2005 which showed the topical application of ketoconazole seems to increase hair growth in mice, right? But it also is been shown to do it with men as well. And in this particular trial in 1998, they said that the effect of 2%, they wanted to look at the effect of 2% ketoconazole shampoo used with or without minoxidil. And what they found was that hair density and proportion of anagen follicles were improving similarly by both the ketoconazole and minoxidil regimens. And so that the fact is that it may, because of its effects on the Malacia furvers species, which is a fungus, it may, well, ketoconazole kills Malacia. It may offer some benefit in that regard. They kind of feel that the inflammatory reaction by Malacia species on the hair follicle may be the cause of why ketoconazole, or may be linked to hair loss, and by using ketoconazole twice weekly and killing off this particular fungus, it can help with hair regrowth. So yeah, definitely something to also add on. For my patients, I recommend the 2% shampoo, which is prescription only. It works the best, and utilizing it twice weekly, it does tend to dry out your hair, so be careful with this. You put it on your scalp and hold it there for about 5 to 10 minutes and then wash it off, but I only do it twice weekly. Okay, Finasteride and dutasteride. Well, these are very common medications that are used in hair loss, and most people know about these. They basically inhibit, so that enzyme 5-alpha reductase, which changes testosterone to DHT, they inhibit 5-alpha reductase. So finasteride primarily gets type 2, where dutasteride is a newer version of the 5-alpha reductase, gets both type 1 and type 2. And with finasteride, it seems to have a higher decrease in DHT levels. And this actually correlates to some superiority in hair regrowth. And so you can see in this particular article, which was done in 2017, it basically looked at 90 men with androgenic alopecia, and what they found was the the increase in total hair count per centimeter representing new growth was significantly higher in the dutasteride group versus the finasteride group. And this was with a dose of either 0.5 milligrams of dutasteride or 1 milligram of finasteride for 24 weeks. So, I mean, based upon this, and actually many other studies, it may be more efficacious. Now, here's the thing you kind of have to be careful about. I am of the impression that it's probably not a good idea to use the 5-alpha reductase inhibitors long term because DHT has a lot of good effects on the body. It's not just this evil evil hormone that causes hair loss in men. It's linked to liver health, kidney health, production of the eye film, as well as pancreatic processes. It also binds to the testosterone receptor 10 times as much as testosterone, 10 times as strongly as testosterone. So in certain low areas where there is low blood flow, it may be very important because it can get there and it can have a much more potent response. And this particular review article, which was published in 2020, kind of talks about the side effects associated with finasteride, which include things like non-alcoholic fatty liver disease, insulin resistance, type 2 diabetes, dry eye disease, the potential for kidney dysfunction, all of which are correlated with long-term use of these drugs. So, whereas I do think that these drugs have great utility in preventing hair loss, what I do for my patients is I usually tell them to use a smaller dose. I don't typically use dutasteride since it's very, very powerful reduction of DHT levels or 5-alpha reductase enzyme. Its inhibition of 5-alpha reductase enzyme is very potent. I prefer to use finasteride and use smaller doses. A typical dose of finasteride might be 1 milligram daily. So I usually suggest patients use like 0.5 milligram of finasteride Monday, Wednesday, Friday. So you do get some benefit. You don't get as much reduction as you would if you use 1 milligram daily or 0.5 milligrams of dutasteride daily. But it's enough so you do get some benefit and you're not likely to see many of the side effects. And if you use it in conjunction with Minoxidil and Ketoconazole, you're likely to get a good result. Okay, the other thing that you probably should look into is microneedling. So what exactly is microneedling? Microneedling is basically a process in which you take a needle and you create lots of little tiny little punctures, and there are maybe some of you guys have seen like micro rollers or microneedling rollers or something called a derminator, which I'll demonstrate in a bit. And the idea is when you create these tiny little punctures around your head, it works by stimulating stem cells and inducing activation of growth factors locally around the hair follicle. And why is this important? Well, if you are looking into utilizing minoxidil, you got to use microneedling with it. It works so much better. Here's a great article that talks about how individuals that utilized microneedling and minoxidil versus just minoxidil had a significantly greater increase in hair count. So there's 100 cases of individuals with mild to moderate androgenic alopecia, and they're recruited into two groups. One group had minoxidil without microneedling, and the other group had minoxidil with the 5% minoxidil solution. And there's a significantly greater increase in hair count with the minoxidil and microneedling group. And so there are many ways to do this. The microneedling device that I recommend is the Derminator 2. This has been used very commonly in the hair loss community, I guess, and it's very, very popular. A lot of people seem to recommend it. Lots of positive anecdotal experiences. And it is it works really well by both men and women. Women tend to use it a lot because because of the increase in growth factor and stem cells, your face can look younger. And this lady is utilizing it to help with her skin. And there's a great little video here on the Terminator website that demonstrates how to use it. And this individual over here, you can see some balding at the crown, at the vertex, right? And by utilizing minoxidil and the derminator, he was able to recover significantly. And this, this is just one example, but I've seen this occur with many of my patients utilizing it. Okay, so we talked about the medications, but what if you're like, you know what, Dr. Ryan, I'm just going to do what you do and just like shave my head, but I do want to kind of have the appearance that, I have hair, just, maybe something where I shave my head, but I just do it because, that's just the style I like, but I want to kind of look like I still have the follicles underneath it. And so, hey, that's fine too. There is another process called scalp micropigmentation. So what is that? Well, scalp micropigmentation is essentially just medical tattooing of pigments that correlate with your hair color right along your line. And so it gives you the appearance of having like a hairline, and it can cover up like little areas around the vertex, or particularly around the scalp. And here's a good picture of somebody. So you can see with this individual here, he shaved his head and he had some balding, frontal balding right here. And by using SMP, which again is just the micro tattooed pigments, it was able to give the illusion of a nice hairline, albeit shaved. There have been some articles talking about SMP. And in this particular article, this was done in the International Journal of Dermatology in 2019. This was, they wanted to look at the effectiveness of, they called it scalp medical tattoo, SMT, versus here in the States, we call it scalp micropigmentation, and looked at it in terms of patient and surgeon satisfaction for covering up bald spots, right? And it looked like out of a score of 5, it's a 5-point Likert scale, the average satisfaction scores of patients and surgeons were 4.8 and 4.9, with a total of 80 patients who underwent the SMT. So, this is definitely a thought to consider if for some reason you're like, you know what, I just don't even want to mess with mess with the medications. Well, you could always just do SMP, have the appearance of a nice hairline, and that's good to go. And then in terms of my patient group, with my patients that want to maintain their hair, the vast majority of them have done really well just with the combination of minoxidil, foam, Ketoconazole shampoo, Finasteride at a lower dose, and then of course the microneedling. This is a must if you use minoxidil. And then SMP is also an option. I've had some patients that prefer the shaved hairstyle, and after getting it done, of course, look around. You got to make sure you get a good, essentially it's a medical tattoo artist, right? You got to make sure and vet the SMP centers out there. But the individuals I've seen with it looks great. And as for me, well, I've kind of found that if you have if you have more pigment in your skin, and it's a little bit darker, I've kind of found that just daily shaving works pretty well. And that works well for me. And you might find that, hey, if you have significant balding already before starting TRT, maybe just try that and see how it goes. But you don't have to, and there's plenty of other options. So the point of this video is just to really show that, hey, starting TRT doesn't necessarily mean you have to, although whereas I like my hairstyle, it doesn't necessarily mean you have to emulate me. There are many ways to keep your hair, as well as options for, like SMP, where you can shave down and have the appearance of a hairline. Okay, well, hopefully this has been helpful, and I'll see you guys in the next video.